Okay, so after doing a lot of reading, tons of investigating, and maybe spending some time on my YouTube channel, my page, my Instagram, you've decided you want to come off pellets and either stop hormone therapy or go on FDA-approved hormone therapy. So one of the next questions you might have is, how do I wean myself off pellets? And that's what we're going to cover in this video today. If you don't know what pellets are, it's becoming a more popular form of unapproved, unregulated hormone therapy, which in my opinion really stems from the fears surrounding FDA-approved hormone therapy. And one of the reasons I spend so much time on social media is to help break down these myths, because pellets are more dangerous, they are more costly, they are unregulated and problematic for many reasons. So if you are thinking about coming off your pellets and weaning down, definitely watch this video. I'm Dr. Heather Hirsch, and I'm the clinical program director of the Menopause Clinic in Boston, where I work and I also see patients. And yes, I get lots of referrals for patients who want to come off their pellets and that kind of compounded non-FDA approved hormone therapy. And the first thing I do when I see a patient like this is always let her know, and you, my viewer, that if you've been on pellets or compounded hormone therapy and you're a little worried about it, or you feel embarrassed or ashamed or guilty or whatever, angry, whatever emotion it may be, it's okay to process and have that time to do so. I always say that I understand exactly how you got there. You noticed a problem, you're proactive, you wanted to improve your quality of life, and so you did what was available to you. Again, a big part of the reason I have this channel is to help break down myths about FDA-approved hormone therapy, not just for you, the viewer, but also for clinicians, because part of the problem is if you go to your doctor and they're dismissive about it, that's how you may end up on pellets. And I have a whole video here I did on why your doctor may be dismissing you. And in other parts of my work, when I'm not making YouTube videos for you guys, I'm working on helping to educate the medical community. So give yourself a moment of reprise and say, okay, I tried that, it didn't work, and now I'm on to better and brighter things. Now, if you're wondering why I don't recommend pellet injections and you want a deeper dive on that, maybe you're on them, you can check out this video I did here. Now, many of you are going to come for me in the comments saying that you love your pellet injections and so on and so forth, and that I don't know what I'm talking about. But, certainly I am a clinician. I have lots of expertise in this area. I've been doing this for many, many years. I also attend lots of the annual meetings for which we don't recommend these types of pellet injections. And the biggest reason is because FDA-approved hormone therapy is safer, it's much more affordable, it's definitely better for long-term use, and also I know that I can help you to feel just as good on FDA-approved hormone therapy as on pellets, but much, 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 much safer. And how do I know this? It's because I do it every single day in my clinic. Many women are surprised to know that pellets are not FDA approved and they are not safer, even though they are highly touted to be. And the other argument I hear a lot is that, well, I've tried hormone therapy and it just didn't work for me. And to that I say, I bet you just didn't find the right formulation for you. I teach this in my Masterclass, and I also help patients do this in my clinic. Okay, so how to wean down. So the first thing that I do when I have a patient come in is I start with asking what were her original symptoms, what were her periods doing before she started on pellet therapy, and really kind of get that baseline, because it can be really thrown off after you've been on pellets for a while. The second thing that I do is check and see where her labs are. Very commonly, I see super therapeutic levels of testosterone, way out of range, almost or often into the male range for testosterone. The second thing I do is check her estrogen, and then the next thing I do is figure out if she still has her uterus, her ovaries, when menopause was, all of those things, because those will all matter in terms of what she's doing with a progesterone. Now remember, progesterone, you can check those labs, but they're not very helpful. The main reason for progesterone is to protect the uterus from unopposed estrogen. So I need to sort of see where everything is. So first thing first, I get that history, find out what her periods were doing, why she started on her pellets, get her current labs, including her testosterone, estrogen, and if necessary, an FSH if I didn't know for sure she was all the way into menopause before she started. And then, really kind of get down to what female organs do you have? Do you still have your uterus? Do you have a cervix? Do you have your ovaries or fallopian tubes? Specifically your uterus, that really matters. If that estrogen level is really, really, really high and I don't think she's been on the right level of progesterone, then I'm gonna check an ultrasound to see what her uterine lining is doing. And if I'm still concerned, despite what the ultrasound says, I have a really good video here on why you might need an ultrasound in, menopause when you're on hormone therapy and what that all means. But depending on the result of that, even if they look normal, I may go forward and do an endometrial biopsy because I want to make sure that when you were on your pellets, you didn't increase your risk for uterine cancer, which I've alluded to the fact that there's lots of risks with pellets, and uterine cancer is significantly high on that list. So I want to make sure that your uterus has stayed healthy while you were on your pellets and as you're transitioning off. So then I reverse engineer it and I actually figure out, if I was starting from scratch, what actually you would need. And again, I help you with this in my clinic and in my masterclass. And once I know exactly what I believe that you needed from the get-go, then what we have to do is wait for those estrogen and testosterone levels to start to float down. And that can take the longest. For example, many women will come in with testosterone levels of 100 or 200 or up to even 250 or more. Now, the normal reference range for women for testosterone is between about 2 and 45, or some labs will say 8 and 60. So 100, 200 plus is really high, and it's going to take months for that level to come down. And this is what I see in my clinic. Now, a lot of women really liked that feeling of the testosterone. It gave them that boost. It's a reason why people love pellets. But the problem is that high level of testosterone can cause all sorts of serious problems. Again, check my last video for that. But we got to give it about 2, 3 or more months for that testosterone to come back into normal range. Now, even though your testosterone is going to be high as it's floating down, let's say month 1 it's 200, then month 2 it's 100, and then month 3 it's 70. Even though those levels are still much higher than, say, my other patients who are on testosterone, as those levels are coming down, I notice that my patients really kind of feel pretty crappy. And I don't actually know what that's from. It could just be from the downturn of it, or that the levels are going down, but you might not feel so great during that time. And the testosterone does take the longest to come all the way down, and I will not start you back on testosterone. And again, I'm only going to do topical testosterone. I did a video on testosterone here once those levels come back down into the normal range for women. Next, we have to wait for your estrogen levels to flow down, and I find those come down a little bit quicker than the testosterone. So maybe it takes 4 to 6 weeks. Once those levels come back down, say around 30, 40, 50, then I can restart you on your FDA-approved estrogen. And that's gonna help kind of buffer that testosterone that's coming down and kind of making you feel a little bit crummy. We also need to make sure that your sleep is good, your exercise routine is good, you're hydrating yourself well while you're kind of waiting for these levels to wash off and then restart on the FDA-approved estrogen and progesterone. Now, what's absolutely crazy is that a lot of women who are getting pellets don't even actually need testosterone, but that surge of it at the beginning does feel really good and seems to kind of wash away all these menopausal symptoms. But the majority of women actually really need estrogen. So for many women, as the testosterone levels coming down and we restart the FDA-approved estrogen, there's actually only, I would say, about maybe a third or a half of my women actually then go on to use testosterone. Now, NAMS recommends either using low doses of androgel, which you can get commercially available, or testosterone does need to be compounded because it's not FDA approved, but I make sure that I use very, very low levels for appropriate female dosing of testosterone for postmenopausal women. All right, so that's a little bit about how we can wean you off. And there's so many reasons to do so. If you have been thinking about it, if you've been worried about the price, if you've been worried about just it not seeming natural, and if you've been wondering if there are safer, better options, 1000%. Please share this video to someone who you think needs to hear it. Please share it across your social media. You are my army of women, and it is with your help that we're going to help the trajectory of women's midlife health. We're going to demand that our clinicians learn better evidence-based medicine around appropriately prescribing FDA-approved hormone therapy, and better learning who's a good candidate, because so many women are. If you love this video, check out the rest of my playlist on hormone therapy, which is linked here. And if you want to work with me, you can do through 2 ways. You can see me in my clinic, of which I have an extraordinarily long wait time to see me. It's way too long for you to actually get help. or you can also consider my course, the Reclaiming Menopause Masterclass. The link is down in the bio. I walk you through exactly how to put these pieces together. We do weekly calls and have just an amazing sisterhood. So you can check that out. Thank you so much for watching, and I'll see you guys next week for a brand new video. Bye everyone.